everybody, welcome to this episode of Back Pain Truths. Today I came across a particular article which is by Optimum Healthcare. Now, I know the problem is with low back pain issues. Obviously, there's a lot of people who suffer with back pain, and unfortunately, a lot of people who jump on the bandwagon trying to make money out of whatever they can think of. They say that can help people with back pain. Today I came across something that made me cringe a little bit, to be honest. It's an article which is talking about new laser light breakthrough treatment eliminates back pain and sciatica pain of the worst kind in just 15 minutes. Now, in just 15 minutes, it seems to be a little bit quick as well to my liking. I've been in clinic for 20 years, having treated many back pain conditions. I don't know, I just almost personally feel it borders on a scam, but I was reading some of the research behind it. Yes, I mean, I've got experience using laser for some other reasons, but I can't really see how laser is going to eliminate, because the word eliminate means you can totally get rid of your back pain or sciatica pain, which to me means you're going to get rid of it and it stays away. Now, laser, as far as I'm aware, doesn't really have the way of totally getting rid of any kind of pain in the first place. The other problem is that, generally speaking, 98% of all lower back pain problems have a mechanical based reason. So laser or any other things like pills, acupuncture, all those kind of forms of treatment are not going to deal with the particular mechanical based problem. Now, let me just explain it a little bit in more depth for you. Okay, we're back. As I mentioned before, I just wanted to go a little bit more into depth on how back pain really starts in the first place. 98% of back pain tends to be mechanically based. Now, I generally speak about what we call the 4 stages of back pain development. Stage 1 is where, because of postural habits, could be somebody sitting in the office all day, certain sitting habits, could be sitting a lot in the car, or could be even, standing kind of postures whereby the spine is just somehow not stressed in the right way, and it's like this happens day in, day out. Could be faulty sporting techniques, the same idea during the training, during competition, is whereby the spine is being stressed incorrectly, or somebody might be, because of their work or whatever it may be, regularly, maybe day to day, places but quite a lot of physical stress on their spine. Because of that, over a period of time, eventually people end up in what we call stage 2, which is you develop a dysfunction of the spine, or also what can happen is that at some point muscle imbalances will start to occur. So in a way, the muscle imbalances also then can cause, again, the dysfunction of the spine. That goes on for a while, and then eventually people end up in what we call stage 3. So because the spine has been dysfunctioning, there have been muscle imbalances, so the spine can't function the way it should function. So excess stresses may be placed on the spinal joints, the facet joints that can start to lock, or the discs become weakened. So discogenic problems could be a herniation of the disc, or other types of problems will occur. And then stage 4 is where you start to get the pain. And so pain from a locking joint, a disc type problem, or any other problem like ligamentous overstress, whereby the ligament, you get maybe some micro trauma to the ligament, scarring building up, and that eventually will start to cause pain. Now, most treatments will concentrate on stage 3 and stage 4, so there may be pain relief like medication, acupuncture, laser therapy. In this case, we'll be talking about the laser therapy, so which is very much focusing on stage 4. So the mechanical symptoms, unlocking facet joint and disc problem or any other problems, are not being treated at all. Nothing is being done at stage 2. The dysfunction or the muscle imbalances are not being worked on. In other words, stage 1, is there any thought being put into that maybe somebody, all the way going back to the beginning, where did the problem start in the first place? So maybe, as I said, somebody may have a faulty sporting technique, etc. So this is really where the treatment should be concentrating on, not just stage 3 and 4, but also stage 1 and 2. So just hope that this maybe explains things a little bit more for you. I hope you enjoyed this particular episode. Please leave a comment, ask me any questions you have, and I hope I will be seeing you in the next episode. Thank you.